Now, genetically modified organisms, or GMOs, have become a significant part of the food supply chain. But how safe are they from a medical perspective? Are there any long-term effects of consuming GMOs? News Central correspondent Bettina Nwelih explores the science behind GMO foods and their health impacts.
Genetically modified foods are created by altering the DNA of plants and animals to enhance desirable traits such as pest resistance, improved nutritional content, and higher yield. But how does this impact human health?
We have been doing a lot of researches on GMO foods. GMO foods are not good for human consumption. They cause cancer. They cause a lot of affliction, disease, and whatever you can think of. Through the researches we've done, we are totally against it.
The consensus among major health organizations, including the World Health Organization and the National Academy of Sciences, is that GMO foods currently available on the market are safe to eat. Even with the assumption that they may not be safe, some Nigerians are left with no alternative, considering the economic inflation as well as the inability to differentiate between GMO and non-GMO foods.
I'll buy it because there's nothing to buy. Because most food out there now, they are almost all the same.
It's said not to be too healthy, based on what I've heard in the past, that because of the fact that they use things like fertilizers to build up such, it might not be too, but they're always cheaper. Even in developed world, it's like that.
Technically, GMO foods are already on the spread because, so while technically eating GMO foods, our beings are genetically modified already. So we are all still eating GMO foods. So there's no debate, but there have been debates about its risks, but it hasn't been proven yet.
Despite scientific consensus, public concerns remain. It's essential to address these concerns transparently and based on facts.
One can assume that is something that is safe for people to use, right? But again, we need to see what the long-term implications are. There's been a lot of debates and argument around its safety and all that. But here in Nigeria, we are yet to hear from the government, even though recently there's a rumor that the government of Nigeria has said that it is safe for use, right? We also have other agencies. The Ministry of Science and Technology is there. We have NAFDAC and other agencies that can, look into this and then tell us if GMO is, safe for us or not.
While it's natural to have concerns, genetically modified foods have been a part of human diet for decades, and extensive research supports their safety. According to the American Association for the Advancement of Science, genetically modified crops and genetically modified organisms are the most extensively tested crops added to the food supply. In Lagos, for News Central, Bettina Nwelih.